Welcome back to Healthcare for Teens, a channel dedicated to helping teenagers understand more about the different areas of healthcare. Today, we have with us Dr. Wakenda Tyler, an orthopedic oncologist at Columbia University. Dr. Tyler, thank you so much for being here with us today.
Thank you. Thanks for having me.
To start off this interview, I'd like to ask, what exactly does an orthopedic oncologist do on a daily basis?
Yeah, great question. So, orthopedic oncology is one of those kind of small subspecialties of orthopedic surgery. We are surgeons, orthopedic surgeons trained in orthopedic surgery, but we've chosen to subspecialize and do further training in the specifically surgical care of patients with tumors that are in the bones and soft tissues and ligaments. So, basically, that includes all the muscles, tendon, ligaments, and then, of course, the bones of the extremities and pelvis and shoulder girdles. So all those areas get covered, and they can be cancerous tumors, and they can also be benign tumors like lipomas and things like that. We kind of cover the spectrum and do all of that different type of care. Obviously, the things that we do most specifically are the cancerous things in the bones and soft tissues, but we also care for benign things as well.
Of all medical professions, why did you choose to become an oncologist?
Yeah, great point or great question. So oncology for me really comes from a personal place. In college, when I was thinking about medical school and trying to make the decision to go to medical school, I had a close friend who had cancer, and she ultimately passed away shortly after I started medical school. And I think that that greatly influenced my decision to want to do oncology. I wanted to take care of people with cancer. I felt that there was a need for that, and that there was and that it was fulfilling for me in my career. So that's where the start of the oncology aspect of it came from.
What does your journey as an oncologist look like so far?
Right. Like, how did I get to this point? Obviously, you go to college for 4 years. Some people take 4 or 5 years, depending on the major that they're majoring in. And you don't have to necessarily major in pre-med or major in like a science major, but you do have to fulfill certain specific requirements that are required for medical school. And those are often science-based: physics, chemistry, biology, pathophysiology, anatomy, those sorts of things. Then and you have to do well. You have to be essentially an A student. Maybe an occasional B is okay, but you really need to be a pretty good student for the most part. And then you take these tests called the MCATs, which are a kind of a standardized test that just kind of tests your knowledge of the pre-medical information. So hopefully you do okay on that test. They kind of uses most medical schools just kind of use as a benchmark. You don't, to kind of make sure that you have the basic knowledge. And then you apply to medical school. Medical school's another 4 years. I did 4 years of medical school plus an extra year. I got my master's in public health while I was at Johns Hopkins, which is where I went to medical school. And so I did an extra fifth year of my MPH before graduating from Hopkins from medical school. And then to do what I do as an orthopedic oncologist, you do a 5-year residency training program in orthopedic surgery. So that covers all of orthopedics. You learn all of the different aspects of orthopedics. I did that at Hospital for Special Surgery in New York City. And then I happened to do a fellowship beyond that. And in this case, it was a 2-year fellowship. Some fellowships are 1 year, some fellowships are 2 years, but this was a 2-year fellowship at Memorial Sloan Kettering Cancer Center in specifically musculoskeletal oncology, so orthopedic surgical oncology, kind of learning the specific things you need to know to be a good orthopedic surgical oncologist, to learn how to take cancers out of people's bones and soft tissues and tendons and ligaments, etc.
What types of cancer do you work with most frequently, and how do you diagnose those cancers?
Yeah, probably osteosarcoma and chondrosarcoma are the two most common cancers that I see in the bones that are primary bone cancers. I also see a lot of patients with metastatic cancer. Metastatic cancer to bone means that they had a cancer that started in some other solid organ of their body, the breast, the lung, the kidneys, and it spreads to the bone. So that's a kind of a different subset of patients. But when we're talking about patients that are presenting with primary cancers of bone, chondrosarcoma, which is a cancer that the origin cell is cartilage, but it becomes cancer, or osteosarcoma, and in that situation, the origin cell is a bone cell, osteocyte, which is the technical term for it, but a bone cell that also turns into a cancer. So those are the two most common ones that we see.
How much, if at all, does artificial intelligence impact your field?
Ooh, at the moment, not much. I expect there'll be some changes as time goes on. You know, artificial intelligence will probably play, we don't know, I actually don't know how it'll play a role in the future. We're always going to need the skill of surgery is a very specific skill that takes a lot of repetition, a lot of learning. Even with the help of robots, which are used in our field now, in orthopedics in particular, and some degree in orthopedic oncology, the robots can't function without the humans sort of giving them the input and confirming that they've registered and done that input correctly, and created the input correctly into a correct algorithm, because robots make mistakes all the time, and so just like humans do. So right now, most of our field is focused on using robotics assisted surgeries. We do a lot of 3D modeling for our tumors. So that part of orthopedics has really changed, 3D modeling of tumors and cancers in the bones, and using those 3D models to help us with surgery. Will artificial intelligence come into that? I don't know yet. Surgery is so different from patient to patient. I never do the same two surgeries. Every single one is different because every patient is slightly different than the next patient. They're not all the same. Every tumor is slightly different. And so artificial intelligence often works off of standardized information, and it's a little bit harder to standardize information when it comes to cancer. So I think it'll be a little while before we're using that in a more specific way in oncology. It'll happen in orthopedic oncology, but I think we're a little ways off from that. I think it will happen quicker on the medical oncology side, which is the side where they're giving the chemo and the medications. That's sort of the that's the medical correlate to what I do. In a lot of ways, they'll probably be able to create algorithms, and they already do it now, that you have a certain cancer, it has a certain genetic makeup. They put that genetic makeup into a algorithm or into a computer system, and the computer system tells them what they think might be the best chemotherapy for that particular cancer. We're already doing some of that already, just using computer programs to do that. Will artificial intelligence help us? Probably to some extent.
What areas of research are you involved in?
Yeah. So I've done research in different areas throughout my career. And I originally started out doing some basic science research looking at metastatic disease to bone. That was something that I was very interested in early in my career, and I still am. I'm not doing as much of that basic science work now as the clinical practice has gotten so busy. But now my clinical research is more focused on disparities in cancer care. So that's one area of interest I have a strong interest in. So disparities in people that are underserved or underrepresented in medicine, and how those disparities are manifested in health outcomes, and how we can more importantly impact and improve those health outcomes in patients who are not receiving ideal care, or not receiving the outcomes we would like to see them see. So that's most of my research these days.
What advice do you have for young teens that aspire to become medical professionals?
Mm. Keep an open mind on everything. Don't get focused in that you want to do one specialty, like right off the bat. Like, don't decide at age 16 you want to be an orthopedic oncologist, because there's so many different ways your path may take you. So be open to the shifting like life and path. Be somewhat focused on the academics, because I think I'd be lying to you if I didn't say it would be really hard to get to medical school if you don't have a good academic record. Doesn't mean you can't have some flaws. So don't beat yourself up or have a major heart attack if you don't get the grade you expected in one class. That is by no means going to result in you being torpedoed out of medical school. That's not how it works. When people look at resumes, they look at the entirety of the resume. In fact, we sometimes like to see a little diversity on that resume. So if it's all A's, I mean, that's nice, but sometimes a little boring. So, it's okay to have a B or a C, and don't get yourself beat up over that. But do show that you are working hard. One or two B's or C's, and it is not going to hurt you in any major way, but a track record of B's and C's and not A's is probably going to impact your ability to get into medical school. Those are the big things. And don't be afraid to expose yourself to medicine. Like, get out there and volunteer. A lot of our medical students were first emergency medicine technicians and things like that before they went to medical school. And so those are good ways to expose yourself, or volunteer for a summer at a clinic, helping little old people get from the car door to the radiology suite. So there can be all these other like volunteer activities. That was one of ways that I got exposure when I was younger to medicine, which is volunteering at a cancer center. And so those types of things can be really helpful. And they may not be the most prestigious jobs. You may be just volunteering, moving bedpans around and cleaning toilets for the hospital, but you're helping and you're seeing and you're getting exposed to medical care. And so it's still a worthwhile venture, is what I'd say.
That's it for this video. And Dr. Tyler, thank you so much for the opportunity to interview you.
You're welcome. Thank you for having me.